How do I know if I have a non-union, and what is that? Well, if you've had a fusion of your neck, sometimes the fusion does not heal. And we call that a non-union because a fusion is the joining of two vertebrae together. We remove the disc, we put bone graft or other types of material inside to fuse or join two bones together. And often that includes some titanium hardware like a plate and screws or pedicle screw bones that go in the bones in the low back. If the bone doesn't heal together properly, you'd get more pain. Most people are fully healed at 3 months. If you're healed at 3 months, your pain should be going away. If you're still having a lot of pain, you may have a non-union, and that's when I need you to tell your doctor, I want a CAT scan. X-rays aren't good enough in my experience. CAT scans will tell you if your bone is fused or not to determine if you have a non-union. Hope that helps you out today. Thanks.